Good evening, Commonwealth, and thanks for watching the Channel 2 News. I'm Ashley McDowell. Let's take a look at tonight's top stories. The coronavirus has been spreading to different countries. We get an update from CHCC. Also tonight, we tell you why medical referrals is part of the deficit for 2019. And the CNMI is celebrating those who protect our borders. In sports, give these students a giant trophy. They earned it. Stay with us. These stories and more are next.
What is whole home Wi-Fi? Whole home Wi-Fi spreads Wi-Fi across your entire home. Pods plug straight into the wall. No messy cables. They spread the internet from your modem to every corner of your home at full speed. Whole home Wi-Fi doesn't just make your Wi-Fi faster. It intelligently adapts to your environment and manages your Wi-Fi 24/7 based on insight like the number and types of devices connected to your home. Whole home Wi-Fi, powered by Plume. Learn more at docomopacific.com.
Every morning we roll out the quality. Grade A eggs. That's what we're made of.
It already has a flaky fish patty, melted cheese, and creamy tartar sauce. So what can make the Filet-O-Fish any better? Nothing, except making it bigger.
The double Filet-O-Fish is now at McDonald's. All the flavors you love, times 2.
Hafa Day to Wami and good evening, Commonwealth. Today is Friday, January 24th, 2020. A new virus from China has people all over the world worried and afraid. Our Sally Lemus heads to the hospital to check on how the public here in the CNMI should handle the situation. And it has been confirmed by CHCC that there is no cases of the coronavirus in the CNMI at this moment.
Research shows that the coronavirus originated from animals and then onto humans. In China, specifically Wuhan province, an outbreak of the virus has occurred, affecting those who traveled in and out of Wuhan. KSPN speaks with Zoe Travis, CHCC's Public Information Officer, to better understand how the CNMI should handle the situation.
The outbreak, it came at an unfortunate time because it's the Lunar New Year, and so that's when a lot of Chinese people are traveling, and people are traveling in and out of China. So that outbreaks tend to kind of spread during times like that. If the Spanish flu pandemic started because of travel around the globe, and so it's a concern. But as of now, the CDC's last release said their belief that there's a significant threat to the American public is low, although there was one case identified in Washington state.
The virus has moderately spread around Southeast Asia, but the Commonwealth Healthcare Corporation has been briefed and advised by the Centers for Disease Control and Prevention on what the proper measures are.
So the precautionary measures that the CDC is undertaking focuses on screening passengers coming in from areas where the outbreaks are occurring. So the Customs and Border officials work with the CDC. They're provided a manifest of all the passengers who are arriving, which includes their recent travel history. So if we see someone coming in from one of those problem areas, they can, they'll kind of flag them on the manifest, they'll call the CHCC, and they'll have one of our surveillance people from the Emergency Preparedness Program go out there, and they will, interview that person, ask where they've been, how are they feeling, did they have exposure to dead animals, they have a questionnaire that they have developed, and they'll ask those questions, they'll go through and, decide if the person needs further care.
CHCC is also working together with the Department of Fire and Emergency Medical Services to carefully transport potential patients for further treatment.
The CHCC itself has protocols for upper respiratory illnesses and isolation. We just were talking a few weeks ago about measles, and this type of virus is spread very similarly, where you're coughing or sneezing and the droplets get in the air, someone else gets them, in an orifice, and then they can become infected. So, we happen to be preparing for this even before we knew it was an issue.
Travis states that the coronavirus is transmitted the same way as the common cold and flu, and CHCC is suitably prepared and trained for this.
So a lot of those really basic, what you'd think is, basic, and we just repeat it because it's easy, it's not. Hand washing is the number one most important thing you can do. Coming in after an outbreak or a natural disaster, the WHO, they just start setting up hand washing stations. Hand wash, hand wash. Do it correctly, do it for at least 20 seconds. Make sure you get all over your hand. Make sure you're using soap. And if soap and water aren't available, using hand sanitizer. So that's just the number one thing, is just wash your hands.
Cleanliness and awareness are vital for the public to know. CHCC continues to advise everyone to avoid contact with sick people and undergo proper hygiene.
We're not under a significant, serious threat, but if you want to protect yourself and take a little extra precaution, undertake those basic hand washing and hygiene steps, because you're protecting yourself not only from the coronavirus, but from the flu, which, the coronavirus it's new, there's a lot of information coming in, but the flu, at the end of the day, is a bigger killer so far. That there have been, I think, over 6,000 deaths from the flu this year, with just a few from this coronavirus. So it's important not to dismiss it and say that it's not a problem, but to just make sure that you're thinking through it critically, taking into context how serious the threat is, and keeping updated.
CHCC continues to remain in contact with CDC and the World Health Organization for updates and recommendations. CHCC is also partnering with the Governor's Office, Homeland Security, and DFIMS to assure the safety and health of the CNMI. Reporting for KSPN, I am Sally Limis.
The deficit for 2019 was around $88 million, and a portion of that is in medical referrals. Medical Referral Director Ron Sablon explains why. A breakdown of the fiscal year 2019 deficit has been provided by the Secretary of Finance, David Adelig, who states $49 million is due to disaster recovery costs. $3 million is due to law enforcement operations. $5 million is on other operational costs. $16 million was falling short in revenue projection, and $15 million is in medical referrals. CHCC Medical Referral Director Ron Sablon states they start off the year in deficit because they are very much below the amount requested in funding for medical referrals.
There's been a little misunderstanding on this deficit issue, because we become deficit actually the first month of the fiscal year. Because normally we get budgeted about 20, anywhere at the most is probably about 22% of what our requested budget is.
In 2019, Sablon says $18 million was requested and only $2.2 million was approved.
Last year alone, we sent out about 1,997 patients. It cost us about $15 million last year. We submitted a budget for $18 million. So we're within anywhere from 3 to 5% of what we request versus actual expenditures. Why we're never funded for the amount we requested, that becomes beyond our control. But we stay within data that we use for all these years, and when I submit my budget, it's basically based on those data, giving a little option because we never know who's going to get sick or how many people we have to send out.
Sablon states there is quite a lengthy process in getting a medical referral for services not provided here on island.
The process normally starts with private physicians or CHC doctors would probably recommend that this person needs to be sent out based on their medical condition. And he submits what you call our medical referral application. With that, we meet with a committee, which is composed of 8 doctors, and myself and a couple other staff, that reviews all the records and to make sure that we're just not sending people out without, when treatments are available here.
He states the process takes about 2 weeks depending on the acceptance from the clinics. Then they break down the costs.
We have income criteria, Generally, some of the patients have private insurance. So first is the insurance that covers it. Then we go into our income base, whether the patient is qualified, where we cover the remaining 20% or whatever, or if they're an indigent patient or people that just have no income at all, then we more or less foot the costs. And there's a 80,000 lifetime limit for patients, and once they reach that, then it becomes a personal liability.
But how are people still sent off island to receive medical attention when there is no money to cover the costs?
Fortunately, the governor has 100% reprogramming authority under medical referral, so he's able to, transfer funds from other departments to cover this cost. But again, if it was properly budgeted, then the governor didn't have to do that, and would not hamper other departments or anything on their budgets. But realistically, it's never happened. We've always been underfunded.
It is the first time in the CNMI to celebrate International Customs Day and CNMI Customs Week. To make it official, a proclamation signing happened this morning. Sally Lemus reports.
Today is a great day for us for Customs. It's an honor for me to take part in this proclamation for the first ever Customs Week. I think it's great for our community to learn more about customs services and what we do to serve our community.
It was just yesterday when the Division of Customs Service announced the success of one of the biggest interceptions of illegal drugs into the Commonwealth. This morning, we celebrate that success and those before. But more importantly, we celebrate customs officers who work hard every day to keep the CNMI safe.
The most important thing about being a customs officer is to embody the core values of vigilance, integrity, and professionalism. So really we must always keep our guard up to safeguard our community, to keep everyone safe, not just ourselves and our border security, island security, but really at the heart of it is our family.
Customs are responsible for preventing contraband and other prohibited items. They are also responsible to properly assess imported items, which is a great deal to the island's revenue. Custom officers operate with no margin of errors, forcing them to stay on top of their game.
The most challenging part of our job is literally the stopping of contraband at the ports. These guys are smart. They try and find different ways to get contraband through the ports, and it's our job to stay on top of things. Criminals, what we tell each other is that criminals are 10 steps ahead of you, so you got to be smart, think outside the box, and figure out ways, figure out different things to protect our ports.
As the CNMI recognizes and celebrates Customs Week, one way the community will be able to participate is to stay watchful and report any illegal activities you know of. This is Sally Lemus for KSPN News.
Some of you may have noticed some whales swimming around in our waters here in the Marianas lately. This weekend is your chance to get some information on why they're here. The Pacific Islands Fisheries Science Center has been studying whales and dolphins since 2010 in the Marianas, and specifically the humpback whales in 2015. The study focuses on the winter months of January through March to see if they are just passing through or actually mating and giving birth here. On Sunday, January 26th, Marie Hill from the Pacific Islands Fisheries Science Center in Hawaii will be giving a presentation at the American Memorial Park titled, quote, Mariana Archipelago, Humpback Whales, linked to other Western North Pacific breeding and feeding grounds, end quote. The presentation will be at 6 p.m. Coming up, visitors are here from California to give growers some safety training in pesticides. Stay tuned.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. Hi, my love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
A new year, a new decade, brings new opportunities. At Pacifica Insurance Underwriters, we are happy to help. Rest assured, Marianas.
At one of Saipan's beaches, this mother lays about 100 eggs under the cover of darkness. She hides her nest as best she can and then slowly makes her way back to the ocean. The eggs hatch and the babies head for the sea, where they will face a daily dose of danger. Just 1 in 1,000 will make it to adulthood. Those that do will one day lay their own eggs. Sea turtles are protected under CNMI law. If you see one that is stranded or if you see illegal activity, call the hotline at 287-8537. Welcome to the Marianas Eye Institute. Our office on Beach Road is staffed with U.S. certified eye care technicians, doctors that have received national recognition, and a friendly, professional staff that will look after you and your loved ones. With over 1,200 eyeglass frames to choose from and an in-house lab, we can make most glasses in about an hour, and we even feature a mobile clinic to bring eye care to you. Keep your eyes healthy and strong with professional eye care at the Marianas Eye Institute.
Welcome back to the Channel 2 News. The correct use and regulations of pesticides on all crops in the Marianas is important to improve the health of residents. And one team from California is here on island to provide training to local farmers.
It's the pesticide safety training for growers by the AG Safe Food and Farms.
We're actually based in Modesto, California. We're a nonprofit organization that helps farmers in all of the issues affecting their workforce. So how to keep people safe, how to make sure they're paying them correctly, and as the case today, how to make sure they're safely using pesticides.
Safety training is an important intervention to reducing exposure to pesticides. And today, many gathered at Northern Marianas College to get some hands-on advice.
We're very excited about today's training. We not only do we have almost 60 individuals participating here, but we're also live streaming right now to Rota and Tinian, where we have an additional 80 farmers who have come together across the islands, which to me just says there is a commitment to ensuring that individuals know what to do and how to do it safely.
But this isn't just for the person applying the pesticide.
So a lot of times we think about how to ensure the person doing the pesticide application stays safe. This is about all those individuals who aren't necessarily doing the pesticide application, but might come in contact with the product after the fact.
Wolf states some safety tips on how to avoid exposure to pesticides.
Some really critical tips like washing your clothes safely, right? We're not washing them with the clothes that we have for our family to ensure that there's no potential cross-contamination. How to ensure you're wearing proper personal protective equipment. So, are you wearing gloves? Do you have long sleeves on? Are your feet covered? Really critical issues to ensure that you don't potentially come in contact with a product.
Becoming better aware of the dangers and creating a balance between having a successful farm, but doing it with caution.
We want to ensure that farmers have access to important tools that help address pests, whether those are bugs, whether those are diseases. We obviously want to ensure that the farming community here is thriving and is prosperous, and sometimes that means choosing to use a product to address those pest pressures. But these are products that can potentially harm us as individuals, as humans, that could cause issues for animals. And so it's how do you have those two things in balance? How do we ensure that farmers have access to tools that allow them to be successful, but that they're using those tools safely? And one of the things that we know is so critical in this is communication, ensuring that there's open communication between those using the product, those that are in and around in our farming community, to ensure that if something is used, they know that they're doing it safely.
Wolf says they hope to travel back to Saipan for more training, but in the meantime, plans to provide digital education to continue access to information and resources.
Thank you, Ashley. Coming up, if you bet on Saipan Vegas, you won the jackpot. Hey, don't cash out yet. KSPN2 Sports is next.
deserve more.
I know it's been hard. Come on, let's go for a ride.
Hi, welcome to Dow Rent to Own.
Thank you.
You're welcome.
Now this feels like home.
Dial Rent to Own.
Making lives better since 1987.
Buenas sports fans. Buenas sports fans, today while you were devouring your lunch, the Rockball champs got something shiny for their cabinet. Mr. Fager is serious about a lot of things, but nothing more than his own invention, Rockball. This year's champs were Power Up, who spent the season sacrificing lunchtime to play this hybrid sport, and it paid off with these once-in-a-lifetime photos to share with friends and classmates, holding the hardware that they won by sweeping the finals and taking the 2020 Mariana's High School Rockball Championship. Jim Fager's game has a lot of exotic rules. Wency says one of them is why they have more quality hits in rockball than volleyball.
You have 5 touches, of course, which gives you chances to make less errors.
Immediately after the awards ceremony concluded, the news hit the social media like a key. That's rockball term. All right, congratulations. All right, coming up, our UFO game of the week. Saipan Vegas, did you bet on them? Be a good bet. Saipan Vegas in green versus Toyota Wheels in fire engine red. Pull the alarm. Leo Galarsi's on fire. De Castillo to Galarsi. Oh, Leo. He was a lion on offense. It was a 10-point zip after that bucket. The Wheels finally get on the board on a Castillo three-pointer. More Vegas. Tolosa, the 12-footer, in the lane. Bucket. De Castillo from the top of the key. Bucket. The Wheels get rolling. Don Brennan. Oh, there's no roadblock, so he went right through. Vegas takes a break at the wrong time, and Toyota cashes in. Hey, I thought theft was a crime. Who says crime doesn't pay? It does. It's worth 2 points for De Castillo, and there's the proof, the evidence. Vegas hits the jackpot with plays like this, letting Galarsi cash in all his chips. Don Brennan drives a Toyota. So does Bobby Coldine. Hey, he didn't steal it. He only steals the ball. And he scores sometimes. Vegas doubles down on its bet. Jones. He squeezes in the shot for the Wheelers, who trailed by 10 there. Check it. Make that a dozen as Basana adds to the carnage. Leo, the Lion, gets a tip in. He's strong. At halftime, the odds favored Saipan Vegas. Second half, Toyota gets a replacement, a spark plug. Steve Lyles, the Wheels get to within 4. But it's too much Galarsi. He wins that one-on-one matchup. Good passing here. Castillo finds Tolosa cutting to the basket. That was good. Everything was good. Good for them. Passing, shooting. They go on to win this game 88-76. It's the Friday night feature when we tip our Marmars for the top plays of the week. And this week, we got a 4-head save, baby. Coming Coming at number 2, Ed Diaz hitting a game-winning three-pointer in overtime. Ed Diaz, top play number 2. And the KSPN2 Sports Top Play of the Week, Abel Leon Guerrero with the forehead save. That's right, a forehead save. Top play of the day, top play of the month, top play of the year. Heads up, Abel.
Here's the windup and the pitch.
I don't believe what I just saw!
Come drive. Kids carts available now at the Seaside Circuit, and best of all, adults go along for free. Teach your child how to drive the best way possible by letting them take the steering wheel. You'll be along for the ride just to make sure things go smoothly. Kids carts, the Seaside Circuit. Bring your local ID for a special half-a-day rate.
Traveling or laying over on Guam? Don't wait around. Zip into Guam Adventures Zipline Park inside the Hilton Resort and Spa. Guides will take you through a series of zips, starting with a mountain course and then zip over the ocean with spectacular views of Tumon Bay. 6 zip lines in all deliver a thrilling experience, and it's family friendly, so bring the kids ages 6 and up. You'll love the security of double lines and a new braking system to make riding smoother. The towers are named after the islands in the Marianas. We call it the Island Hopper. Your guides will teach you what you need to know to soar through the jungle with a bird's eye view. Best of all, for residents of Saipan, Tinian, and Rota, you can book this experience at 20% savings. Log on to GuamAdventures.com and during checkout, use offer code HAFA20. Book it and zip it today. We'll even pick you up. All right, today's high 85, the low 74, humidity 70%, tomorrow partly cloudy, isolated showers, easterly winds 10 to 20 miles an hour. High 86, the low 76, seas 8 to 7 feet with chop. Sunrise 6:47, high tide at 9:11, low tide 2:35, and sunset at 6:11. 6:11.
All right, thank you, Bob, for that.
Oh, you're most absolutely welcome.
So the kid saved the game, or we thought he
yeah,
saved
the volume
it.
right there, and I think what
Forehead.
happened, but he saved 2 points. They lost the game. The problem is, I don't know if he got a headache or not, and then they lost. So.
Yeah.
But anyway, he saved 2 points on that one play, so he made a great play.
It is. You know what? It's the thought that counts in those situations. Thinking with your head.
Yeah, I don't know if he was really thinking.
Yeah, true. I think
he tried to get his hands up, and it just
couldn't make it fast enough.
Fast enough. So.
Well, it was a good top play of the week for sure.
Yeah.
All right. Well, thank you for watching, and enjoy the rest of your weekend. Tune back in Monday night.
Oh, and that weekend starts right now. See you Monday.